Well, from excessive dieting to excessive workouts, the pressure to be thin can be overwhelming. Some cases can turn to unhealthy eating habits to try to achieve a body image they think they need. Dr. Jeannie Sykes, a registered dietitian with Cone Health Family Medicine, joins us today to talk about eating disorders. And Dr. Sykes, let's just start off with a definition of an eating disorder. What is it?
Well, eating disorders can take a lot of different forms, and you can have certain eating disorder behaviors at one point that can sort of morph into other types of eating disorders. So typically we think of anorexia nervosa, which is where food is very restricted and people are not getting enough food intake. And then also there's bulimia nervosa, which is where food is eaten but then purged, and that can be self-induced vomiting, or it can be laxative, or sometimes even diuretic abuse. There's another type of purging. It's sort of controversial as to whether it's really purging, but compulsive exercise can be part of that too.
Yeah, we're going to dig into all of those in just a few minutes, but I want to get people at home involved in this. Go to our app, WFMYnews2.com or WFMY.com, and weigh in. Where do you think the pressure surrounding weight control comes from most? Is it from social media, peers, entertainment, family members, or perhaps yourself? WFMY.com. /vote now and get those votes coming in. So when it comes to eating disorders, most of them are about food. So talk about that.
Well, you know, we love to say that eating disorders are all about food and not at all about food, because we see the behaviors. What an eating disorder is manifested as is behaviors related to food, either eating too much of it. Of course, I didn't mention binge eating disorder. That's another type of disorder. But eating too much, eating inappropriately, or restricting. But the underlying causes of eating disorders are really not about appetite and food at all.
Right.
And they are usually about what we would call emotional dysregulation. So food gets used as a tool or a coping mechanism for dealing with difficult emotions.
Right, and feelings about yourself.
Yeah, I'd say it's pretty universal that people with eating disorders don't feel good enough, smart enough, good enough athlete, good enough student, just adequate.
Right, but there's so much help out there.
Yes, and at Cone Health we have dietitians and who specialize in eating disorders, and there are therapists, and usually what I like to see if someone is dealing with an eating disorder is that they get help by their family physician, a dietitian, and a therapist or counselor of some type.
Absolutely. Well, you've already given us so much great information. Is there a symptom that's attached to an eating disorder that someone should be able to look out for?
Well, it can be subtle, and some of the symptoms that are really most concerning can be the most subtle initially, and that is cognitive changes. For example, with either anorexia or bulimia nervosa, you can have malnutrition happening. And so if you have malnutrition, your short-term memory, your ability to focus, your just fatigue can get in the way of doing better at school or at work. And those signs can be very, very subtle initially. They eventually catch up with a person, but those are things to be looking out for. And obviously when it's noticeable that a person is just not eating much, pushing the food around on the plate a lot and not really consuming much, that's a red flag. Or needing to use the bathroom immediately after the meal. Weight loss obviously is going to be one sign, but you don't always see weight loss because you see such fluctuations of intake over time sometimes.
Well, thank you so much. We really appreciate it. And let's keep this conversation going. You can go to WFMYnews2.com, look for the To Your Wellbeing section, and there's advice and also tips from Cone Health right there on our website.